Hi everyone. Good evening. Good evening. How are you? How's your day been? And welcome to ATP Live Monday. Being Mr. Laboide and your anchor for today's program. So thank you so much for joining us wherever you're joining from. On Facebook, on YouTube, on Instagram. You're welcome to ATP Live Monday. I'm just going to first share the videos to all our groups so that everybody will know we're live and they can join us. Good evening, everyone. Okay, so welcome to those who are joining us. I'm also just going to share the video. It's gone live in my the ATP Live Monday. This is what I try to avoid. Okay. Okay, I'm just going to share the video first, so just give me a couple of minutes to do that. Okay, then I think I want to share to our groups. Just give me a minute to do that. Welcome everyone. Please share the video as well. Invite friends, invite family to join us. Okay. Welcome everyone. Welcome. I'm just sharing the video as well. Sharing to the groups. Okay, all right. I think I'm done with all the sharing. So thank you so much for your patience. Welcome to ATP Live Monday, everyone. Uh, this program is brought to you by Hacks the Pediatricians. This is where we get to talk about important health issues that affect our children. You also get to ask any questions that you may have about the health of your children, and I'm happy to answer them in the next 1 hour. Atp Foundation is a non-profit organization in Nigeria that is completely committed to the health and the welfare of children globally, but most especially in sub-Saharan Africa, including Nigeria, where a lot of our children are still dying from preventable causes. So we do that online through health education, health information, and we also do it offline through our community medical outreaches in communities, in schools, in faith-based organizations. So thank you so much for joining me today. And remember that this program is just for 1 hour, but if you have any questions after the live session, you can always go to our Facebook group. We have a massive Facebook group, Ask the Pediatricians, where you can ask any questions. So somebody is joining me from YouTube. How amazing. I always like people joining me from YouTube. Thank you so much, Emil Anibe. Is it Emily Anibe? I'm not quite sure I'm pronouncing it well. Okay. Anyway, thank you so much for joining me. Thank you so much for watching. Welcome everyone. So I was just going to say that after the live session, if you still have any questions, go to our Facebook group, post your questions there. We will answer your question within 48 to 72 hours, even earlier sometimes, but just be patient with us. But if it's something like emergencies, your child is very ill, please do not just drop questions and wait. Please take the child to the hospital, and we are always happy to see you at the hospital. But for health information, health education, you can always post on our Facebook groups, and we'll try and answer them as soon as we can. So thank you so much for joining me today. If you have any questions, if you're watching on YouTube or Instagram, you can just drop your questions straight under the video. If you're watching on our page, the same thing applies. Just drop your questions in the comment section under the video, and I will see it and I'll be able to answer your questions. But remember to start with the age of the child. Remember to give a short summary of what the issue is that you want me to address, and then ask your specific questions. Okay. But if you're watching in our Facebook groups and you have a question, please remember to click on the video so that it will take you to the page, and then you can drop your question directly under the video, because that's the only way I'll be able to say it. So thank you so much. I already have a question from Pearl. Thank you so much, Chieke, from Facebook. You're welcome. So your first question, say, when can salt, pepper, and seasoning cubes be used to cook a baby's food from 6 months plus? Okay, that's a very good question and very important question, because I think the issue is that there's been a lot of misinformation online, especially nowadays. We thank God for social media, and we thank God for the opportunities like Facebook and YouTube, Instagram, to share a lot of health information. And when we first started, it was just few of us doing that. But now, because obviously everything on social media is monetized, so a lot of people come online to give a lot of information, and some are just merely content creator, whereas some of us are here because we really are just after the health of the children and not for the financial motivation. So because of so many people are on social media sharing all sorts of information, I think it's our responsibility as parents, responsible and sensible parents, to make sure we know the source of information. And it's natural for us in Africa that it takes a village to raise a child. So everybody is a deputy parent in a way. So everybody has an opinion about what should be done or should not be done when it comes to the health of children. And if there's any area where there's been so much confusion, misinformation when it comes to the health of our children, is the issue of nutrition. What should a child eat? What could a child not eat? And so that's why I know where Phil is coming from. And people believe, oh, maybe you should not add seasonings, you should not add salt, you should not add sugar or whatever to the baby's food. You just leave the food plain as that. Actually, that is not true. We, the pediatricians, never said that. Nobody ever said you cannot put salt. Like, no, if you are boiling rice for your child, you should not put some rice. Also, you should not put salt when you're boiling yam. Obviously, nobody ever said that. I'm not quite sure where that information comes from. So, but I see a lot. Mother asks me those questions a lot, so I know there's a lot of other people sharing those kind of information. So let's start by saying that that is not correct. Nobody ever said you should not season children's food. And one of the things you must do when you are cooking for your children is that the food must have taste. And I now, from some of these kind of posts, I now know where some children come from, that they don't want to eat food because we want to give our children even the food that we ourselves cannot eat. And one of the things I always say, friend, anything you must give your child, even drugs, taste it yourself first. That will help you to have a good understanding of how the child is tasted. So if we as parents, we cannot eat food that doesn't have salt, that is completely bland and tasteless, how do you want the children to eat it? So we should, so from day one, from 6 months, when you start solid, please, you can give your child food that is seasoned. Okay, what we preach as pediatrician is moderation. Obviously, we do. In fact, most of the time, what they all these excessive salts and sugar is actually not from the food you cook in your kitchen. It's not from what you cooked. It will be surprising that it's from things that you don't even suspect that they have a lot of them. That is where you actually get most of this salt and sugar overload from. Most of these things that we bought in cans, most of those canned products, canned food, most of them have to be preserved. And by virtue of the fact that they have to be preserved, those are the food that are often overloaded with salt and with sugar. It's part of the preservation, it's part of the sweetening process. But if you cook food in your own kitchen and you had a little bit of salt to give it a little bit of taste, that is not a problem at all. And that is not the kind of excessive salt or excessive seasoning that we as pediatricians are worried about. It's actually the other product that people sell to you that you don't even think about, that actually have loads of those seasonings and salts and preservatives that can be very harmful. So everything is about moderation. So from 6 months, if you are boiling yam or potato for your child, it's okay to add a little bit of salt to give it taste. Okay, if you're cooking other food, it's okay to add your little bit of seasoning. Again, moderation, just to give it a little bit of taste. Okay, and people worry about white sugar, like if you make pap or something for your child, it's okay to add a little bit of sugar. But if you are worried about sugar, you can use natural seasonings, natural sweetener like dates and all those ones. They can make the food sweet without necessarily being white sugar, but you can have it. The only thing we don't want you to give children is honey. We don't want you using honey before the age of 1 year, because honey can, there's a condition we call infant botulism. So there is a particular bacterium, Clostridium botulinum. It has some spores, okay, and those spores tend to be in honey, especially the natural honey. So if and children do not have, infants before the age of 1 year, they don't have the enzymes a bit to, to kind of deal with that spores. So if you give your children honey or use honey to, sweeten their food, they can be exposed to that botulinum spores, and they can't deal with it, so they can end up having a condition which can be fatal, which is a very fatal condition called infant botulism. So we don't want children to have honey at all before the age of 1 year, when we know they have the enzymes to deal with it. Otherwise, you can use sugar, you can use dates, you can use salt, you can use them in your cooking. Moderation, just a little bit of taste, nothing overloaded, okay? And what you should even run away from is those stores bought products, because those are the ones that tend to have a lot of those salts and sugar, a lot of all these about pastries and all that. Those are the junks that we say you should stay away from and avoid in children, because those are the ones that actually are overloaded with salt. So we don't want to give your children junk food, but natural sugar in fruits, natural, a little bit of salt from your kitchen into cooked food is not going to cause any harm to your children. So I decided to go into details about that question, because it's something that worry parents, and a lot of mothers cook food that don't have taste, don't have anything, and they give it to the children, and then they come and worry us the pediatrician that my child doesn't like the food. I said, if you taste the food yourself, will you like it? Most of us will not like it because it's tasteless. So please, whatever you cannot eat that doesn't taste in your mouth, don't give it to the children. That is actually being fair to our children. So give them the food. I always tell parents a very simple thing is anything you can eat, your child can eat. Actually, that's actually as simple as it can be. Anything you can eat, your child can eat. It's just that when you are starting at 6 months, you have to give them something not as solid, because obviously they can't chew, so it has to be very soft, mushy, or porridge like. And then as they get to like 9 months, 1 year, then they can start taking more solid. But sincerely speaking, there's nothing you can eat that your child cannot eat. Of course, we also don't want you giving them spicy stuff, too much of pepper. Pepper is actually not calories. So I know some of our culture in Africa, actually I come from the southwest, where people believe that if you don't eat pepper, you're not going to be very strong. I don't know where that comes from, but there's no scientific basis for that statement. So a lot of people believe eating a lot of pepper and all that, but really children don't need pepper. Pepper doesn't give them calories. There's just so much food that children can eat without much pepper, without you even needing to do any seasoning. Lots of natural stuff that you can give your children and they will love it. And I think there are a lot of dietitians, a lot of nutritionists that have put a lot of recipes online. I just say you can watch them. I'm a pediatrician, but I did my nutritionist colleague have done a lot of work in that area. So just check out some of the recipes, how you can mix them together, and you can give your children. I hope that's helpful. All right, let's move on to Emilia Anive from 932 from YouTube. Thank you so much for joining us from YouTube. I really love it when people watch YouTube. Okay, so Dr. Gumi, how is it possible to avoid the sickness of kidney disease or diabetes from newborn to adults? Because a lot of children keep getting diseases. Okay, thank you, Emily Anive. This is a very important question. Very, very important. Yes, there are a lot of things we can do. So I will try to break them into two, because you asked about kidney disease and then you asked about diabetes. I think I'll start from diabetes first, because that is easier, because most of the time diabetes is something genetic. It is just something some people are born that way. So we have two types of diabetes. Let's start with saying there's type 1 diabetes, there's type 2 diabetes. Most of the time our children tend to have type 1 diabetes. So type 1 diabetes is where the children are born with this condition that they cannot produce insulin. Insulin is the hormone that control our blood sugar. Okay, and some people are just born with something with the pancreas, or the pancreas is the organ that produces the insulin. So if anything, you are born with that way, and you can't produce insulin enough, or complete low no insulin, or very little insulin, that child can have diabetes. And most of the time they have no control over that. It's something mostly likely genetic that runs in the family, so you can't prevent this kind of diabetes. So those ones are type 1 kind of diabetes. It's just some people just have it, and there's nothing you can do about it. It's just something you're born with. But type 2 diabetes is the one that we all can do something about, because that one has to do more with the food we eat, obesity, and all that. So, and we can control that. So people that are very big tend to have what we call insulin resistance, and they can have that. Type 2 diabetes also can be genetic, can run in families, but at least there are some ways we can still work with type 2, because in type 2 there's still some insulin, but either it's not, there's some what we call resistance to the insulin, or there are other factors. So diabetes is a little bit more complex, it's a little bit more complicated, and sometimes people have no control over having diabetes or not. Sometimes if it runs in your family, you can just have it, even though you are not doing anything wrong, so to say. But the good news is that even if you have it, it can be managed properly. So if you, with good diet and all that, we can manage it. And for children, if they have diabetes, some of them have to be in insulin for life, and we just have to manage it for them. The most important thing is early diagnosis, and then they're controlling their calories intake, taking the insulin, and they'll be okay. So a little bit of diabetes, a little bit of not much we can do. But when it comes to kidney disease, that one, there are again two types. There are some kidney conditions like nephrotic syndrome and some other conditions in kidneys that we can't do much about. Again, sometimes these things just happen, and people are born that way, and there's nothing much you can do. But there are lots more kidney conditions that are due to injuries to the kidney. And one thing that a lot of us mothers and parents can do, especially for those of us in Africa, where we tend to use drugs and herbal remedies indiscriminately, that is one area where our kidneys get damaged. So we give our children a lot of drugs that we don't even know what it is for, or that we don't even that were not prescribed by the doctors. And we do a lot of herbal drugs in Africa, and some of these so-called herbal remedies can cause damage to the kidneys. Some of them are made with alcohol. Alcohol damage the kidneys as well, including the liver. So we really need to be careful that we're not giving our children all these so-called herbal remedies, because they can damage the kidneys. And again, let's avoid indiscriminate use of drugs. Again, in urinary infections, urinary tract infections, if it's not properly treated, it can cause kidney damage. So we really need to be careful. We need to teach our children the fact that they need to drink water a lot. They need to go and pee whenever they feel like peeing, so that they don't keep their urine. The longer you keep your urine in the bladder, the more likely for bacteria to get in and grow and cause infection, and and that can spread to the kidney. So there are lots of things. So in summary, because it's a big question, but I'm trying to cut it short, there are things you cannot do anything about. So having some kidney disease, having some diabetes is actually out of your control as a parent and for the children. But there are certain conditions that we can do a lot of things about. Also knowing the blood pressure. It's not very common in children, but for us as young adults, high blood pressure is one of the common causes of kidney damage. So when we know we have high blood pressure, controlling our high blood pressure, taking our drugs regularly. Children can also have hypertension. Adolescents can also have hypertension. Controlling it will limit the chances of the children having kidney disease. Another one that is very common, which I really need to point out, is for our male children. There's a condition we call posterior urethral valve. It tends to affect the boys, and one of the things you must notice in the boys that have posterior urethral valve is that their urine stream is not straight. So usually when boys are passing urine, and every mother, once you have your baby boy, you must watch their urine. You must take off the nappies, and you must at least not more than once or twice, see them pass that urine. And when you see them pass urine, they must, the urine stream must be straight. It must go. So sometimes if you're not careful, it just goes straight to your mouth. And I'm sure most of us have seen that, you take out baby diaper and then you pass urine and you see it flying straight up to our faces. We really need to say that. It is very normal. So we need to be sure that our baby's urine is actually flowing for the boys. Because if your baby's urine as a boy is not flowing straight and is dropping, that boy may have what we call posterior urethral valve, and it has to be repaired as soon as possible. It's something we do, it's a surgical procedure that we will do to correct it. The reason is that if we don't correct it on time, it causes a lot of what we call urine backlog to the kidneys. The urine is not flowing out completely. A little bit of it is dilating the urinary tract, and that will get to the kidneys, and that can cause kidney damage. And I've seen boys, at least I've managed one where we're looking how to do a transplant for that child, and that child has posterior urethral valve, but we didn't discover it until the age of 8. And by the time we're discovering it, that boy has now had kidney damage, and that boy needed a transplant. I think we eventually got him transplanted in India. So this is one common condition that is easily treatable, and that we picked it up, and it will prevent kidney disease in the boys especially. So mothers, make sure when you are home, take off your babies from the newborn period, take off the diaper, see them pass that urine, and make sure the urine stream is straight. If it is not straight and it's only dropping, then you must come and see the pediatrician or the pediatric surgeon, and we can quickly arrange for the surgery to be done. So these are some of the things we can do to reduce the incidences of kidney disease and diabetes. Complications. So, okay, all right. So I got a question here from Pressy Amo. Sorry, sometimes. Please, can I give my baby reload and blood medicine at the same time? All right, thank you so much for that question, Amo. Reload, for those who don't know, is a popular multivitamin brand. Number one, when you're asking questions, always say the age of your child. I always like to have the age of the child. That is very, very important. Okay. So most children, I know a lot of mothers give our children multivitamins. To be honest, they don't really need those multivitamins. If you give them the proper food, I prefer you give them the vitamins as food that they eat. So give them a lot of them fruits, a lot of vegetables. They will get all the vitamins, so they don't need multivitamins. So, but if you're not sure, your child is eating well, it's not eating a lot of fruits, it's not eating a lot of vegetables, and you just want to be kind of certain that your baby is getting their vitamins, it's okay for you to give vitamins, and that is okay. Now, on the same time, blood medicine, it has to be prescribed. I guess you are talking about blood tonic, or what we usually refer to as iron supplements. Some of them also have vitamin B complex or folic acid inside. Those are the common causes of blood anemia, or like low blood level. And so most blood tonic have iron, folic acid, or vitamin B12, or all the three of them together. Now, you don't give those ones unless a doctor has prescribed them. Please and please, I know a lot of mothers, we just take iron supplements, as you like. But for children, do not give them blood tonic or iron supplements unless we pediatricians have prescribed it for you. Because children can overdose on iron supplement. They can have what we call iron overload. Okay, so if your child doesn't need the iron, and the fact that baby is short of blood does not mean it is iron deficiency. There are many other reasons why children could be short of blood. For example, in Africa, we have a lot of our children who have sickle cell anemia. And sickle cell anemia can be the reason why they are short of blood. Those children don't take iron. Iron is actually detrimental for them, because their problem is not iron deficiency. Their problem is something else completely different. So you don't just say, oh, my child needs iron, or just be giving them blood tonic. Please don't. If you think your child is pale, doesn't have enough blood, come and see us first. Number one, we need to confirm whether your child is short of blood by doing a simple blood test, full blood count. Number two, we need to know what is the cause of that low blood level. What is the cause of the anemia? So that is what is going to determine how we treat your child. Okay, so some will need iron supplements, yes. Some don't need iron supplements. Some need something else different. So we need to know what is the cause of the anemia. What we need to deal with is the cause. So if this is iron deficiency, we'll give the iron, and then if it is not, we'll deal with whatever is causing it. Then the dose, the amount of the iron we give, it depends on the weight of that child. Okay, so and the quantity that children needs is not the same quantity as adults. So some of us just think, oh, children are small adults, so I can take 10 meals, I'll just give maybe 5 meals. No, sometimes for the iron supplement, that's really the kind of iron supplement some of us buy, the kind of blood tonic they sell in the market. Most of those blood tonic were made for adults, they were not made for children. So the amount of iron inside 10 meals, inside 5 meals is quite a lot. It's quite a lot for children. So there are other brands that make the one for children that have smaller iron in them, so that we can give them those meals. But if you are giving some of those adult ones, I don't want to mention any brand names so that people don't come for me. So if you are giving some of those brands that most of them are made for adults, the amount of iron, the amount of volume that your child will need to take based on their weight may not be even up to 1 meal. Some of them may not even be up to 2 meals. I'm telling you, and just once a day. So we really need to be careful. So do not give iron supplements to babies unless a pediatrician has prescribed it. And I also emphasize pediatrician because sometimes some of our general colleagues, general practitioner colleagues, they treat our children like small adults. Our children are not small adults. They are completely different. And we pediatricians, every child is different. We prescribe our drugs mostly based on the weight of the child, not on how their age or how big they are. The fact that, okay, this is a 5-year-old, we just give a smaller one. No, we will go by their weight. So we really need to see the child, we need to know the weight, and we need to prescribe appropriately. And then we prescribe it for a specific duration. So we can say maybe for 3 months or 4 months, and then we repeat the blood test again. We even actually measure the level of iron. So we do things like ferritin and other iron studies. So we know whether this is the quantity of iron in the child's blood. Then when we've treated the child, we check the level again, the blood level and also the iron level. If they are not okay, then we stop. We don't just keep giving them for life. So while you can get away with multivitamins and play around with multivitamins, because most of the multivitamins are water soluble. So if you take too much, your child is going to pass them out in the urine. No, you are not going to get away with the fat soluble vitamin like vitamin A and vitamin D, and also blood tonic have to be required for you to be given to the child. And it has a beginning point, you must have an end point. It's not something you just keep giving, as the spirit leads. So very, very important. So I'm not quite sure whether you're still listening to me. You can give your multivitamin, but the blood supplements, make sure it is prescribed by a pediatrician before you give it. So I hope that's helpful. Instagram people, if you have questions, please ask. And I hope none of your questions has rolled past while I was busy on Facebook. Or if you've asked a question on Instagram and I've not answered and I can't see it anymore, please ask again. And my sincere apologies for that. All right. Okay. Thank you so much. I got another question from Agunloye Olubumi. Say, good evening, Doug. God bless you for all your good work. Thank you. Amen. Hotspot mistakenly burnt my 1-year-old baby son. Oh no, I don't like us. I don't like burns in children. It's so painful. So painful. The plate is open. The place is open. There's no blister again, but don't know much. What can I apply to it? When did this happen? When did this happen? Okay, so when it comes to bones, there are some parts of the body that we call special areas, and bones in those areas, no matter how small, must be seen by the doctors. Okay, so bones to the hands is one of them. A doctor has to see bones to the hands. So we must see bones to the face, bones to the hands, bones to the perineal area. Those areas, bones, no matter how small in those areas, they're important because we need to be sure it is not something that is going to cause complications like what we call contractions, because the use of the hand is so important, and burns can cause contractions and all that. So we really need to say. So when it comes to burns, first thing, when hot water burns happen, the first thing we want to do is to cool it down, because the heat is still going to be burning the child even after you've removed the source of the heat. So you cool it down. So the burns and plastic surgeons will say pour hot water. Just run hot, no, and run normal water. I say hot water, sorry, cool water, not like ice cold, not warm, not hot, but just the normal tap water kind of temperature. The normal water that you just put your hand inside. Just pour it generously on the child's hands, on the area, and then you can cover it up, because the second thing we don't want to happen is we don't want it to get infected. So you can cover it with even like nylon, plastic. Just cover it up, something clean. Just cover it up. If you have gauze, just cover it up, and then you can take to the hospital. If it is not the hands, for example, because like I said, burns to the hands, we always want to say common things you can use for burns is your common things you have in your house. Honey is very good. You can pour honey on burns as wound. If it's a very what we call superficial burns, because there are different layer of, again, burns can be mild, superficial, it can be medium level, it can be what we call third-degree burns that it gets to the tissue. So again, that also determines how we manage it. So, but if it's just a minor, thing on the surface, you can pour your honey. You can use there's what we call dermacine cream. You can also use that, or you can also just use some people also work on gentle violets. Those ones are okay for minor burns. You've cleaned it. There's no no evidence like it's getting infected. You've poured the water, then you can apply that. But if it is burns to the hands, burns to the face, burns to the perineal area, the doctors want to say it. And just be sure it's not going to cause complications, because sometimes what we deal with in burns is not the burns problem itself, it's the complication that comes with the burns that is the main problem. So burns can come with the infection, so it can get infected. So sometimes we have to give the children antibiotics, depending on how the burns happened and all that, and depending on how deep it is. So we tend to give them antibiotics to prevent or treat infection. It can get, tetanus can get into burns, so we tend to check the child's tetanus immunization is up to date, and we can give them extra booster of tetanus toxoid. We have to give them higher protein because it takes time for burns to heal. And then we give them also vitamin C that will help with healing. Vitamin C is very important, zinc very important. They help with wound healing quickly. So those are the things that we do for minor burns. For minor burns, you can manage, but major burns you have to take to the hospital. And sometimes I see people post a lot of pictures of burns on our group, and most of them are trying to manage it at home. I really don't, it's not advisable, because by the time people now come to the hospital after things have gone haywire, then it's lots more work. The surgeons have to do lots more work. Sometimes they need to do operation, they have to do grafting and all that. But if you go to the hospital on time, it's better, because we doctors will always look at burns and we calculate what is the percentage of the burns, what is the level, is it superficial, is it first degree, second degree, third degree. There are so many things that we think about. It's difficult to parents to even know or understand all that. So parents just think burns is burns. So which is why I'm always comfortable if you actually see a health professional first, and then we can examine it and can decide, okay, this is a minor one, just go home with this topical treatment and be doing it at home. Or this is something serious, we need a plastic surgeon, we need a burn surgeon to come and have a look. So those are all the things that we need to do. So and then burns to the hands, we don't joke with it. So I really would recommend you seeing them at the hospital, just to be on the safe side. It's really for these young babies is very important. And while I'm still on that topic, I just want to use the opportunity to create awareness on how to prevent burns. Some burns should never happen. Okay, some burns should never happen. A 1-year-old has no business in your kitchen at all. A 1-year-old should never have been in the kitchen, should never be exposed to the pots. So those that kind of a burn should never have happened. So please keep the under five out of your kitchen. Lock them out. Yes, lock them out of the kitchen because they are at the age where they are very curious, they are mobile, they are curious, and they don't understand yet the concept of something is hot, something is cold, they want to explore. So that age is the most risky age for bombs. So because of that, we want them completely way out of the where anything can burn them. So we don't want 1 to 5 years. We don't want them anywhere near the kitchen. Even the infants. I know mothers will struggle because you have to cook, you have to do anything. But as much as possible, you don't also want to be taking children to the kitchen, even if you are the one going to do the cooking. So it's better you keep them out of the kitchen, keep them in their bed in a safe place, but completely out of the kitchen. Is very, very important. So when you go into the kitchen, you keep the children out of the kitchen. And then let's avoid carrying hot stuff around the house. So a lot of us mothers, we carry hot water, carry them to the bathroom. No, don't do that. If you want to make if you don't have hot water running in your bathroom and you want to make water, like you want to have a mix of hot or cold water, take the cold water to the hot water, pour it in the kitchen there, and then take it out. Don't carry the hot water all the way to your kitchen, because the chances of somebody running into you, mommy, 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 and you pouring the hot water on them is high. So we want you to do. So you have to be. If you want to have children, you have to be conscious of the fact that you have to keep the children safe in the house and away from hot water burns. So children not allowed in the kitchen. Don't plug your irons. Don't leave your electric socket open. Always cover them up. Okay. What else? That's why I don't recommend steaming for babies when they are below the age of 1 year. No steaming. Don't say I want to steam the babies. It's also another reason why children have hot water burns. For those of us that like to bath babies, and some of our grandmothers, grannies, they always want to, massage baby with hot water. It's not recommended. Babies don't need those massages. And then some of them, when they want to bath the baby, you pour the hot water. Please put your hand in the water first before you put any water on the baby. Put your hand first. It looks so obvious. It sounds so obvious and so like, why isn't Dr. Baby saying that? That is common sense. But I can't tell you how many newborn babies have been burnt by the hot water that they were going to use to bath them, because somebody has poured the hot water and they've not put their hand inside to know whether they've put in the cold water, and they just dip the baby straight into the hot water, and the baby is burnt. Newborn babies, that is the most common reason we got newborns having hot water burns, because that is this concern that somebody must bath the baby, they must massage them with hot water. It has caused a lot of burns for babies. So I always tell mothers, if you are missing the water in the bath for the baby, put your hand inside first. If you cannot put your hand inside that water and leave it there for 5 minutes, that water is too hot for the baby. Any water that you cannot put your hand inside and leave your hand inside comfortably for 5 minutes, that water is too hot. So the water must be at the temperature that you are comfortable to leave your hand inside. So these are common things. These are simple stuff, but the number of our babies that get burnt every year, it is so it's just so sad, and it's a preventable cause of misery, cause of harm to the children. So please, this is an opportunity for us to quickly address that. And when you're cooking and doing all those hot oil, you're frying, please keep the babies out of there. Keep the children out. Don't let them be running around you when you are doing that. I see a lot of people on social media doing all this content and they're in their kitchen and the children are there. It is not right. And sometimes those things happen in seconds. It's just a blink and it has happened. A blink of your eyes, it has happened, because the children are very fast. So the best thing is to work on prevention rather than having to deal with the management later, because you can't deal with the pain. All right. Okay, I hope I have not, at least I've addressed that. Thank you for asking that question, and that has given me the opportunity to address that. All right, Emily, thank you so much for still staying. Okay, so you're booked for CS at 37 weeks and some days. Can I give birth? 37 weeks is a full-time period. So what once your baby is 37 weeks, that baby can come out. Okay, baby is already fully formed. Uh, just a flash, baby is already been fully formed at 8 weeks. Okay, baby is fully formed at 8 weeks. So that's the issue of. I know there's been a lot of debates about pro-life, pro-choice people. A baby is already fully formed at 8 weeks when most mothers don't even know they're pregnant yet. The baby is already fully formed. So all that happens from 8 weeks to the time your baby comes out is the baby getting bigger and the organs getting more matured. But all the organs are all present at 8 weeks. So that is why the first 8 weeks, when mothers don't even know they're pregnant, is the most crucial, because anything you do at that period can cause injury to the baby's formation. So for example, a mother who is not taking folic acid, when the brain is being formed at 3 weeks, and if you're not taking folic acid at that point, the brain baby can have neural tube defects, brain malformation. And most mothers don't even know they are pregnant at 3 weeks. They've not even missed their period yet. So which is why we are encouraged that you plan your pregnancy. So you are planning for pregnancy, you're already taking your prenatal vitamins, you're already taking your folic acid, so that if you get pregnant, and you are being careful not to be using any indiscriminate drugs or herbal remedies, so that even if you get pregnant and you don't know it yet, you are not going to cause harm to your baby. So at 37 weeks, your baby can come out. The baby is already ready to leave. It's TAM. That's what we call TAM. Any baby from 37 to 42 weeks are TAM babies. They are fully formed. There's nothing to worry about. So your baby being fully formed at 37 weeks is not something to worry about at all. Okay, but you are worried about jaundice. So jaundice, again, some of the questions you asked, there are some things in medicine that we can prevent, but there are some things we can't prevent. We can't do nothing about it. So some babies are going to have jaundice no matter what you do. This has something to do with prematurity, if that's what you're thinking about. So prematurity can cause jaundice, but your baby is 37 weeks, it's not premature. So if your baby has jaundice, it has nothing to do with prematurity. But there are many other reasons why your baby can have jaundice. For example, what is your blood group? If you are blood group O and your baby is A, or your baby is B or AB, your baby can have jaundice. Because if you are a mother who is blood group O and you're already married to somebody who is not blood group O, it means any of your children can have a blood group that is not O, that is not your own. And any baby that is in that situation already have what we call a setting for ABO incompatibility, and that baby can have jaundice if there's some your antibodies begin to fight the baby's red blood cells, something like that. If you are rhesus negative mother, for example, and you've not, let's say this is your second pregnancy, and you didn't take ROGAM, anti-D immunoglobulin, in your last pregnancy, and this particular baby is not rhesus negative, baby is rhesus positive. So if you are rhesus negative, married to somebody who is rhesus positive, which is most likely going to happen because people who are rhesus negative are not plenty. Majority of us are rhesus positive. So if the negative people are going to marry, most likely they will marry somebody who is rhesus positive, which means one of the babies could be rhesus positive, which means your baby can have jaundice, which is why anytime a rhesus negative mother has a pregnancy, no matter how the pregnancy ends, whether with a miscarriage, whether with normal delivery or fetal death, that mother must be given ROGAM, because that's the only way we can neutralize all those antibodies that have been released. If you don't neutralize it and you have another baby who is rhesus positive, that baby can have jaundice, and it can be severe jaundice. So that is what, if your baby juices PD deficient, that baby can have jaundice. So there are some jaundice that you can't do nothing about. There's also physiological jaundice. Most babies will have that kind of jaundice. 60% of term babies, 80% of preterm babies, but usually those ones are mild. So it will clear by itself. So we pediatricians are not worried about your baby having jaundice. The most important is for us to pick up the jaundice on time and to deal with it. So that is why we have to keep an eye on the baby, examine the baby, look for the jaundice. If it is there, we'll treat it on time. As long as we pick it up on time, we can treat it. So we can't always prevent jaundice, but we can manage it. So some jaundice like infection, Those ones we can prevent. Some baby can have biliary atresia. We can't always prevent those kind of conditions. So we just deal with them as it happen. It has nothing to do with your baby being born at 36, 37. No, it's just something that can happen. Or not breastfeeding. Your baby can breastfeed. Why not? Baby, there's no reason why your baby cannot breastfeed. Even preterm babies can breastfeed. Any baby who is at least 1.5, 1.7, they can breastfeed. But your baby at 37 weeks is a term baby, so there's nothing to worry. Okay. So you're welcome, Emily. All right. I don't have any question on Instagram today. I guess Instagram people are just chilling and enjoying, which is fine. Absolutely okay if you don't have questions. I got 10 more minutes to go. I'm still going to use the opportunity for the government of Nigeria to rescue our children, the children that were kidnapped in Oyo State. We really want our children back, and we're appealing to the bandits. Everybody, please release the children. Children should never be bargaining chips in any political stuff. So the way we manage, the way we deal with our children is important. It shows what kind of a nation we are. If we are a nation that we can deal with the most helpless of us, because our children are the most helpless, the weakest in society. If we treat them badly, that shows we're a bad nation. That is just a simple truth. So please and please, the kidnappers. I know lots of things that happen. People are also, getting their hearts hardened by scenarios. But please, the children should never, never, ever be part of what we should be using to get anything, no matter what the message is, no matter what it is that we want to pass across, political, religious. No, no, no. We should never use the children. And please release those children for us. Please. Thank you. And I believe our government is working hard, and I hope they will be able to rescue those children very soon. We, all the pediatricians, we advocate for the children. So we are very, very concerned about the situation where children are now being kidnapped. We are really very concerned about that. And I know the Pediatric Association of Nigeria has released a statement. So please, in Nigeria, let our children come back home. All right. Okay. So if you still have any questions, for those who are just joining, welcome. This is ATP Live Monday. I'm Miss Boyde. I'm a pediatrician, and it's my pleasure to be here every Monday to answer any question that you have about the health of your children. But if you still have any questions after this live session, which is going to end in another 8 minutes, feel free to go to our Ask the Pediatrician Facebook group. Feel free to post your questions there, and we'll try and answer them. All right, I got one more question from Onokoya Tisilayo. Good evening, Doc. My son of 5 years farts a lot, according to his teacher in school. Okay, because I didn't notice it at home. Is there something is lacking? I don't think there's anything wrong with people farting. That is a natural physiological thing to do. There are some food that when we eat, it makes us to be a little bit more. They are more, you are more gaseous, and so you're likely going to pass a lot more fats. Of course, we're all familiar with those foods. So your beans, your eggs, those are common stuff. Some of the legumes, so most of those ones, they tend to make you to granules and the rest of them. So I don't know whether you didn't notice it at home, obviously, because obviously your house will be big and your child will be moving around, and the child can always go and fart somewhere, where you are not. But in a classroom, it's restricted, and the child is sitting there 24 for the 8 hours. Maybe they have 1 hour break or so during break time, but the child will be in that same spot. And it's just, I guess most of the classroom are smaller spaces, so definitely if somebody is farting, the teacher will likely pick it up, especially if it is also very smelly and all that. So there's nothing wrong with that. You just need to watch what the child is eating. Some of us would like to pack food for our children, and some of these packing hot food into all these coolers, it's not ideal. Ideally, the best thing is for the children to have their food cooked hot and served to them in school, rather than for us mothers would have cook around 5 a.m., 6 a.m., pack the food, and the children are going to eat it around 1, the tendency for germs and bacteria to multiply in those food is high. And if the child eats this kind of food, they are going to be more gaseous, even if some of them will frankly will have food poisoning. So ideally, we don't want that. Also, take note that the child is not eating too much junk food and things like that. So let the child eat a lot more fruits, more veggies. Let the child use the bathroom more regularly, go to the toilet to open their bowels, because sometimes the child actually needs to go to the toilet, but they don't want to go. So they keep holding it in. That can also make them to do more of the gas rather than going to the toilet to do a proper poo. So just pay attention to the kind of food the child is eating, and and if possible, if the child is taking food to school, it's better to give them something cold, something that doesn't, like sandwiches, things that they can pack and eat without, not something prepared hot, and then it takes time for it before the child will eat it. The chances of fermentation, the chances of it, having some culture of bacteria multiplying already inside it is quite high. So those are, from my own experience, even as a mother, so those are things that can be causing those kind of things. The fasting is not the issue itself, but we just need to make sure the child is eating properly and opening the bowel properly, and give them food, preferably if the food the school can provide the food, so that the child can eat it hot and not covered up for a long time, is something that we can deal with. I hope that is helpful. So it doesn't mean it's lacking anything. It just means the child needs to eat. Just pay attention. And if there are food that make the child more gaseous, maybe you should avoid him eating those ones when going to school in the morning. You can have it for dinner, or you can have it during the weekends. So less of beans during those days that the child is going to school. Or you can peel your beans. Sometimes peeling your beans and cooking it make the gas to be less. So those are little tips here and there. And then encourage the child to open their bowel either before they go to school or last thing at night, so their tummy is free, and make sure that they're using the bathroom regularly. Drink lots of water as well, so that will be helpful. All right, Emily is asking about after delivery of a newborn baby boy, when is the best time to go for circumcision? Okay, Emily, is it your first baby? I have a feeling you're a first time mother. Okay, I'm very passionate about first time mothers. I actually have lots of resources for first time mother. Um, uh, I guess I have to. It's an app, and talk about everything you need to know as a first time mom, your baby, your companion as a first time mom. But it would be nice if you get hold of some of those resources. When is the best time to go for circumcision? You can go for circumcision from day one. Most culturally, some people go for the circumcision on day 8 because that is culturally acceptable, and also some doctors want to be sure that the child's vitamin K level is a little bit up, so there's no bleeding and all that. But frankly speaking, I know hospitals where if you have a boy, they will circumcise the child that same day before you go home. So there's no hard and fast rules about it, so you can do your circumcision anytime. Okay, but people tend to do it as soon as possible so that the child, depend also on the method you're using. Most people these days use the plastibal method, which is like a bloodless method, and it's just plastic in. So it's very straightforward, very simple. But the traditional surgical method, where they actually cut the child, that is where the doctors, some surgeons, they want the child to actually make sure the child can clot properly. But then these days we give all our children vitamin K. We give them vitamin K at birth. So I don't see any problem with that. So just ask what is the practice where you are having your baby. So some hospitals will circumcise your baby before you go home. Some hospitals will tell you to come back after 1 week. There's no hard and fast rule. Some people do it at home. Like even some culture, the Jews, the rabbi circumcise the boy. So it's not like something big medical per se. The most important thing is after the circumcision to watch out for the common common complications like bleeding or infection and all that. But if it's done properly and you're following the guidelines, there should be no problem with that. Okay, what are the do's and don'ts? So if you go on our Facebook, on our website, we have www.actpediatricians.com. We actually have a whole article dedicated to circumcision, so you can go watch, you can go read that, and you learn. So we've talked about what to do. Like I said, depends on the method you're using. So if it's plastibell, they don't do nothing. You just go back after the plastic has fallen. That's it. It's the easiest one. But the traditional method, most times they may need you to apply some either Vaseline or some cream to keep it moist, and then you go back for them to remove the dressing after a couple of days. Just watch out that there's no bleeding, there's no sign of infection or smelling around it. If there is, they may want to give antibiotics. But most times, such circumcision does heal very well, and there's no issues at all. So, if you want to read more about it, I would just recommend you check our website and read about circumcision, what to do, and all that. So it's very, very helpful. Okay, is this your second child, but you have a boy or you have a girl first? Okay, I guess girls are easier than the boys, but it's okay. The boys are also fine. The only extra is the circumcision and all that thing, but no problem. It's the same thing. Don't worry, you'll be fine. It's the same thing. And like I said, if you go for the plastibell method, you won't even know anything at all, because it just come off and that's it. Maybe after 5 days the plastic will drop, and yeah, the baby is fine. You birth the baby normally, you do everything normally for the plastibell method. It's only the traditional one that there's a little bit of dressing around it, and then they want you to keep it moist either by applying olive oil or you apply a Vaseline or something, and after 5 days or so it has healed, and they remove the dressing, and you can now continue to birth the baby normally. So find out what it is they do where you are having your baby. Yeah, but it's nothing to worry about. Don't worry. Okay, you're welcome. I'm very happy you joined us from YouTube today. Thank you. I don't tend to get many from YouTube, so that's why I'm so excited about it. All right, my time is up and I need to go. Thank you so much for those of you who joined, for those of you who asked questions, Emily, and look at me, and all the rest of them. Thank you so much. Instagram people, I didn't see any of my usual people today, but for those of you who joined as well, who listened in, thank you so much. So if you have any questions on any health issues that has to do with our children, ask the pediatricians. We are there for you. That's why we exist on social media, to answer any questions you may have about the health of your children. We're your partners in raising our healthy children. So feel free to ask your question on our Facebook group. But I always like to emphasize that if a child is very sick, if a child has an emergency, please don't post on Facebook. Go to the hospital. That is where you're going to see all the rest of us. So in the daytime, you're going to see us in the hospital. But obviously, we also come in our spare time to come and answer questions, come and provide health education, health information, because we know that if our mothers, our fathers, our carers, our guardians, they have the right information, then our children are going to do well. They're not going to die, they're going to live. So that is what ATP is all about. That's why we want you to ask us your questions so that we can support you. And of course, like I said, I was saying any of those topics we've talked on today, even while answering those questions, you can read them in details on our website, www.actpediatricians.com. Or if you're the type that prefer to watch, you can watch them on all our YouTube channels. Our YouTube channel, YouTube whatever /ATP TV with double E, ATP TV double E. That's our YouTube channel. Or if you like to listen and watch at the same time, the podcast, you can check Ask DrGbemi ATP podcast. My podcast is available on Spotify, Amazon Music, Google Podcasts, most of the podcast platforms. Just check for Ask DrGbemi ATP podcast. So again, you can listen to all these topics treated in details: bonds, complementary. I'm not sure whether we did circumcision on podcast, but it's definitely available on the website. You can watch them, and I know it's available on our YouTube channel as well. So watch, learn, and if you still have questions, come over to our Facebook group, which is open from Mondays to Saturdays. The only day we have off is our Sundays, but Monday to Saturday, 24 hours every day, you can post your questions and you can get your answers. So thank you so much for joining me today. Have a wonderful rest of your week and have a wonderful evening. And I hope next week when I'll be coming, all those children in Ibadan or York would have been back. I hope so. So thank you so much, everyone. Have a wonderful evening. Bye bye.